Rheumatic heart disease is the most common acquired heart disease in children. It is a chronic heart condition caused by pneumatic fever that can be prevented and controlled. Pneumatic fever is caused by a preceding group A streptococcal or strep infection. Treating strep throat with antibiotics can prevent pneumatic fever. Moreover, regular antibiotics, usually monthly injections, can prevent patients with pneumatic fever from contracting further strep infections and causing progression of heart damage. Strep throat is a disease that causes a sore throat. The cause of strep throat is a bacteria known as Streptococcus pyogenes, also known as group A Streptococcus. Streptococcal bacteria are highly contagious. They can spread through airborne droplets when someone with the infection coughs or sneezes, or through shared food or drinks. One can also pick up that bacteria from a doorknob or other surface and transfer them to their nose, mouth, or eyes. Symptoms include throat pain, difficulty swallowing, red and swollen tonsils, sometimes with white patches or streaks of pus, tiny red spots on the soft or hard palate, the area at the back of the roof of the mouth, swollen, tender lymph nodes in your neck, fever, headache, rash, stomach ache, and sometimes vomiting, especially in younger children, and fatigue. Strep is not something that should be taken lightly, and the symptoms need to be addressed immediately, or they can cause other problems like pneumatic heart disease. It can be treated with penicillin and antibiotics. When untreated, strep throat quickly turns into pneumatic fever and then pneumatic heart disease. Pneumatic heart disease is a condition in which the heart was damaged by pneumatic fever. Pneumatic fever may cause serious, permanent damage to the valves of the heart. Most often, it damages the mitral valve, aortic valve, or both. These valves act like doors in the heart that allow blood to pass between or out of the chambers in the heart. If the valves are damaged by pneumatic fever, they may not be able to open fully. This causes a narrowing of the valve, which is called stentosis, or the valves may not be able to close fully, resulting in a leak or not enough blood supply, called valve regurgitation. Damage to the valves from pneumatic fever is known as valvulitis, meaning inflammation of the valve flaps, which are called leaflets. Pneumatic fever may also affect the heart muscle, a condition known as myocarditis, the inflammation of the heart muscle, or it could affect the membrane of the heart, a condition known as pericarditis. These can lead to problems later on, such as atrial fibrillation, an irregular and chaotic beating of the upper chambers of the heart, or even heart failure. Symptoms of pneumatic heart disease tend to show up to 10 to 20 years after the original illness. The major criteria of pneumatic heart disease is carditis, polyarthritis, which is a migrating arthritis that typically affects the knees, ankles, elbows, and wrists, chorea, also known as St. Vitus dance, which are abrupt, purposeless movements, rashes with distinct borders, and nodes, usually located over the bones or tendons. They're painless and firm. The minor criteria includes fever, inflammation of the joints, previous pneumatic fever or pneumatic heart disease, and leukocytes, which is another form of a rash. Getting diagnosed with pneumatic heart disease coincides with the Jones criteria. This states that the diagnosis of pneumatic fever can be made when two of the major criteria, or one major criterion plus two minor criteria, are present along with evidence of a strep infection. Primary prevention of acute pneumatic fever is brought by treatment of acute throat infections caused by group A streptococcus. This is achieved by up to 10 days of an oral antibiotic, usually penicillin. People who have had a previous attack of pneumatic fever are at high risk for a recurrent attack, which worsens the damage to the heart. Prevention of recurring attacks of acute pneumatic fever is known as secondary prevention. This involves regular administration of antibiotics and has to be continued for many years. If this does not help, surgery is often required to repair or replace the heart valves in the patient with severely damaged valves. A surgeon is able to go into the heart and replace the valve with a new one simply by switching two out for the other. If one would like to know more about pneumatic heart disease, visit the following websites. Thank you for watching.